to introduce our fabulous speaker, and that is Dr. Chris Berlingeri, and she is going to speak to us about common health problems, and that is in our largest organ, the skin. Okay? So without further ado, if I can just place this on you, and that'll help.
So I want to thank Dr. Moyer again for inviting me to do a second talk in the year. I usually do one around late summer regarding like skin care and skin aging and how to prevent that. So we always run out of time with that conference, so it seems like people are really interested in getting to know their skin, and that's not a surprise because it's the largest organ in our body and it's the most visible one. So we always worry about it. So what I did, I just took like three or four common complaints that I see with my patients, and not only in patients, but when I visit family members or friends, since it's so visible, they're always, oh, can you take a look at this? And what's this rash? And what's this? So just kind of like thinking about those broad things that many people have, and just put a presentation together about it. But again, I like to be dynamic. We just had lunch. I don't want you falling asleep. And then just if you have any question at any point, just feel free to bring it up. I'll be more than happy to answer you, okay? I did it very brief because last time a lot of people had a lot of questions. So I just want to make sure we have time for questions and answers, okay? So I like to do an outline of what we're going to talk about. So in your brain, you kind of like get organized. What are we looking forward to, and what are we going to talk about? So I'm going to talk about the most common type of hair loss and their treatments. I'm going to talk about common adult rashes and their treatments. And in this category, I'm going to talk about seborrheic dermatitis, which is called dandruff in lay terms, rosacea, and adult acne. And then I'm going to talk about brittle nails because that's something that we see very commonly in our clinic. To be honest with you, dermatologists don't really like to talk about hair loss and brittle nails, but that's what we're there for. So I think like orienting the community a little bit about these issues may be of great help. And then for the ladies here and some men too do manicures, I'm going to talk just a little bit about the new manicures. I don't know if you ever heard about the shellac and the new gel manicures that they're out there. Some people have brought up questions about these new manicures. I want to touch briefly on that. Okay, so who can recognize that and that seems familiar? Right? So that's the most common type of hair loss. This is a picture of a man, and as you can see, the hair loss is more prominent. This is what we call the frontal area of the scalp, and a little bit more towards the back, right? So that's the receding hairline. And then this is another common area. Some males, you don't see much here, but you see this is what we call the vertex area of the scalp. You see hair loss in this area here, or a combination of both. If you look closely, this particular person has both on the frontal area, has that receding hairline, and that has loss on the vertex of the scalp too. In women, it's a little bit more different. In women, usually the most common type of hair loss occur kind of like in the frontal area as well, but the hairline is preserved. When we part the hair in the middle and put it to the sides, we kind of like describe this in a hair loss of a Christmas tree pattern. It's kind of like losing in that type of pattern array, not like a bald spot, but definitely there's decreased hair density and the hair are thinner than the rest of the scalp. So this is the most common type of hair loss, and it's called androgenetic, meaning from the genes and male hormones. Andro, that's where we get it from. Alopecia. Alopecia is just a fancy term for hair loss in the dermatology world. So that's how it's called, androgenetic alopecia, or just, common hair loss. 50% of the males by age 50 have some form of this type of hair loss, and 40% of women by menopause have some degree of this type of hair loss. So as you can see, it's very, very common. In this case, the hair loss is very gradual. We don't wake up overnight and just notice that we're missing our frontal hairline or the vertex of the hair in our vertex scalp, but it's very, very gradual. The other thing that occurs, not only we have hair loss, but the hair in that area gets thinner, and that also can give the appearance that you're losing even more hair, just because the few hairs that we have, they're thinner. And then it appears that you saw differently in males as compared to females. One of the things that we see in the females, again, we have preservation of that frontal hairline versus in males where it starts at the hairline and recedes back. Okay, and then I have a diagram here taken from our textbook. So you can see in males, this is kind of like stage 1, little bit of hair loss here and there, stage 2, and then more progressively, this is what, the hair loss has fused between the frontal and the vertex, just the bald area there. And then here we see in women, again, we have preservation of that frontal hairline. And then we can see that diffuse Christmas tree pattern like hair loss on that frontal area of the scalp, but again with preservation of the hairline. And again, we have the same pictures just to kind of like review. This is so you can see a more progressive case of hair loss in a female with preservation of the hairline. And here you can see very nicely the Christmas tree. Do you see the kind of like a Christmas tree like pattern to that hair loss? A little bit more severe. Okay. So what is the treatment for this type of hair loss? So the treatment can be either medical, and when you hear your doctor saying medical treatment, that means creams or pills. So the treatment can be medical or it can be surgical, and surgical is surgery of the area. The only proven medications that are indicated for this type of hair loss are Rogaine or minoxidil. I want to say, like, I don't have any conflicts of interest with any of the brands that I'm going to talk about today. Nobody's paying me for anything. So the brand name is Rogaine, but the generic is minoxidil. You can get this in Sam's, Walmart, Walgreens. It's over the counter. And then you can get Propecia. It's a prescription pill that you can use in males for this type of hair loss. So this is your minoxidil or Rogaine. It comes as a 2% and a 5% solution. To be honest with you, they market this as 2% is the female strength and 5% is the male. I don't tell ever my patients to get female or male to start with the 2% because the 5% have been shown to work better. So I just think, honestly, it's a marketing issue more than anything. So just go ahead and get the 5% one, bless you. And it comes as either as a liquid solution or as the foam, kind of like a mousse that you can put on, and it sets up nicer than the lotion. So minoxidil has shown some success for regrowth of hair in 30% of males and up to in 50% of females. The problem with patients with this, first, the hair grows very slowly, and then we have to use it at least for 6 months to call it a failure. So don't use it for a month and say, oh, this doesn't work. So the studies have shown that you have to use it at least for 6 months to call it a failure. And the treatment is lifelong, and patients don't like to hear that. So what I tell them, you brush your teeth every day, morning and night. Put the minoxidil solution next to your toothbrush. Just put it on every day, twice a day, whenever you brush your teeth. So but it's lifelong, because if you stop using it, then all the hair that you preserved is gonna fall off. And then you're gonna go like stressed out because of that. Okay, 7, it's not uncommon for patients to experience irritation of the area, like burning, itching, redness. That can happen. It's less common with the mousse or the foam than the liquid form. And then, like I was telling you, the 5% solution has greater efficacy than the 2%. So if you want to try this, just go ahead and get the stronger one, even if you're a female and it says men's strength. Again, I think that's just for more marketing purposes. So just go ahead and get the 5%. And females, make sure it doesn't like pour on your face, because we don't want to be growing any facial hair. And then my husband uses this, and sometimes I lean down on his head. He's like, no, I put the Rogaine, you're gonna grow. So just be very careful about that. Okay, Propecia, this is the only FDA medication in a pill that's approved for hair loss in males. And it has reversed hair loss in up to 66% of males and stabilized, meaning not much more after that fell off, in 83% of men after 2 years of follow-up. So it's a really good medicine. Again, the downside of this is like it's lifelong. Once I tell my patients, particularly when I have like 21, some males can get this type of hair loss very early on. So sometimes I see like 20-year-olds or 20-something years old, and I'm like, just remember, if we're gonna do this, it's lifelong. So you may want to wait and try and just do the topical first and see how you do. In women, this is not indicated because it can have it can have horrible effects on a developing baby, but again, usually women get this condition after menopause. So I've been to different conferences, dermatologic meetings, and hair experts are using Propecia in females after we counsel them on the possible side effects in the case that they get pregnant. But again, that's very unlikely because it's postmenopausal women who get this. So Propecia, it's off-label in women, but some experts are doing it. Other medications that can be used in females is spironolactone, which is a medicine used for high blood pressure, but it has been shown to have anti-hormonal effects, and that's why it also can be successful for the hair loss, this type of hair loss, because this type of hair loss is caused by hormones. And then we have surgical treatment, which is the hair transplant, and it's a very successful procedure. But it requires, a lot of people come to me and say, oh, I need a hair, can you refer me for a hair transplant, because we don't do this in our department here at UTMB, and they think it's like a one-time deal. But no, usually it needs 3 to 4 sessions over a 2-year period. So it's something that is going to take, again, a long time, but it's very, very, very successful. And it's not only useful in men, but also in women too, so for both of you. These are the red flags. So I talked about the most common type of hair loss, which is called androgenetic alopecia, or male pattern baldness. But please, please, please don't think that every hair loss, if you have, is due to that, because we have some other conditions that can cause hair loss, and it's not necessarily that. So these are the red flags. If you have any discrete or smooth areas of just bald patches, as we saw, the most common type of hair loss, the hair loss is gradual, occurs slowly, and I mean, in males, you can get after years, like a large bald area. But if you have like just a couple of areas, like one here, one there, not in the frontal area, not in the vertex, of just a very smooth hair loss area, go to your dermatologist or your doctor. If you have scales or any dryness or flakiness or redness associated to the bald spots or the bald areas, please come and see a dermatologist, because there's other conditions like lupus, fungus, just other conditions that can cause hair loss. But usually in those cases, you're going to have, again, redness, some flakiness, and again, discrete hair loss, maybe signs of another important conditions that you may need further treatment on, okay? Any questions on hair loss? Okay. Seborrheic dermatitis. Now we're on to the rashes. Seborrheic dermatitis, or dandruff, is a disease that's caused by flaking of the skin. In babies, it's known as cradle cap. It's not contagious. Again, it's very, very, very common, and it can occur at any age, but it's most commonly found in babies and in adults over 60 years of age. The most common areas are these: the eyebrows, the nose, around the nose area, like this area here, and around the ears, and it can cause ear itching. I have a lot of patients who complain of just like ear itching on the inside, and I look to see if they have a rash in these areas, and if they do, it's probably due to seborrheic dermatitis or dandruff. This condition, we don't know why it happens, but it's definitely made worse by stress, either physical stress like being sick, or emotional stress like, you know, the death of a loved one, moving, finals, just any stress that you may be going through. It can, mine got flare after having my baby, so that's a stressful period. So just know that stress can definitely flare this, and this can be easily controlled with medications given to you by your doctor. It can be controlled with over-the-counter medicines too, but when it's very flared up like that, usually we give prescription medicines, and this is usually topical medicines. You don't need any pills by mouth or any other form of more invasive treatment to treat this. Usually creams do the job. This is another common area, as I was saying, either the front or the back of the ear. So eyebrows, around the nose, sometimes a fold here down the mouth, and then front and back of the ear, and the scalp too. So again, we don't know what's the cause of seborrheic dermatitis, but it does run in family. This is super, super, super common. Like, I don't know the exact number, but it's very common. It could be related to hormones, and the cause, they think it could be a fungus, but it's not really a fungal infection. They think it's a normal fungus that inhabits normally in our body that kind of like overgrows a little bit and causes inflammation of the skin. And then again, like I was saying, it's made worse by stress. So usually during stressful periods, it aggravates it. And how is it treated? Again, we can start with over-the-counter shampoos like Head and Shoulders, selenium sulfite, Selsun Blue. But if this doesn't do it for over-the-counter hydrocortisone, but if it doesn't really do it for you, if it doesn't get any better, then definitely we can prescribe something stronger like prescription strength shampoos and prescription strength topical medicines. Okay, going now to rosacea. What is rosacea? Rosacea is another very, very, very common condition. Seborrheic dermatitis or dandruff is very common on the convex areas of the skin, so the fold of the nose, the fold of the mouth, kind of like behind and front of the ear. Rosacea is the opposite. Rosacea is a condition of the concave areas of the face, the cheeks, the forehead, the chin, and the nose. Actually, today I was seeing a patient and I was teaching this point to the resident with me because she thought it was rosacea, but I'm like, look closely, where is located the rash? It's not really on the concave, it's on the convex, so it was seborrheic dermatitis. I'm gonna go to the pictures because I think it explains it better. So there's 4 different types of rosacea. We have, as the name implies, rosacea is kind of like derived from rosy or pink. So there's the first type of rosacea is the one that just causes redness or flushing. This is flushing that stays longer than regular flushing. And it's caused by those little capillaries in the skin get dilated, so you get more blood flow to your face. And then that's why you have the redness. And again, in rosacea, it stays for longer periods of time. Then you have the rosacea that looks like acne. And this is kind of like if you have like a 60, 70-year-old with acne, it's most likely rosacea. And again, it happens on the cheeks, nose, chin. And we treat it similarly to acne. Then we have, and I don't know if you're like, you know what used to be known as kind of like the drunken's nose? Is that the term? That's a type of rosacea. It's not, I think Bill Clinton has that, right? Well, hipalo. But you know, when you get those kind of like fibrous, bulbous enlargement of the nose, that's not really because they drink too much. It's really due to rosacea. So what is happening there, the oil glands of the skin become larger, and then you have more fibrosis and kind of like scars surrounding those oil glands. And that's why it gets very bulbous like that. That can happen not only on the nose, that's the most common areas, but it can happen to the chin and it can happen to the ear too. But the nose is by far the most common area, and you can treat that surgically. And then we have ocular rosacea, and this is very, very important to recognize and to treat because it's present in up to half of the patients with any of the other types of rosacea, and it causes a very mild inflammation of the eyelid margin. And patients often complain that they have kind of like sand in their eyes and their eyes are just bothersome. And this is a very important condition to recognize and treat because if not, they can scar. So usually this patient, they need medicine by mouth. Okay, so how do we treat rosacea? The easiest rosacea to treat is this one. Why? Because we treat it just like acne and they respond really well. The hardest types are these two because first, there's just one medicine that has been recently FDA approved, not even a year ago, almost a year now this spring, that they approved a cream that helps with just the redness of rosacea. The problem with it is Mirvaso. So I'm going to ask you.
Very
yes.
careful.
So when you stop using that medicine, what happens? Did it happen to you?
No, I used it one night
One.
because I have been using another one for years, and it seemed to have worn off. It burned my face. I thought I was going to have scarring.
So Mirvaso, that's the new medicine FDA approved for the redness. And
I
again,
had to fight them. They didn't believe me, but it had
yes.
come out.
So what I've seen, and actually one of my colleagues, she did it because she had this type of rosacea, and she just did it just to see it helps. But when she stopped using it, her face got like 3 times as red and swollen and hurting.
I was afraid my face would never.
So it's, I mean, it does help with the redness.
What about Phoenicia? Because I've used that for years.
Phoenicia helps a lot with this component, and it may help a little bit with the redness. It may, but usually.
Nothing else.
Metronidazole is another FDA-approved medicine for rosacea. And again, it helps more for this component. It may or may not. I have mixed results with patients. In some, it helps with the redness, and in some, it doesn't. So it's very frustrating to treat the red component. Another thing you can do is laser treatment. That can be successful, but it can come back again, so it's not a permanent. And the other thing, look for those triggers. That's what I was gonna mention. Rosacea usually has thermal or temperature-related triggers, warm things. So spicy food, your coffee, your tea, being out in the sun. Just keep a journal, because most definitely you're gonna find a trigger for that redness or that outbreak of rosacea. Okay. And then this one, again, surgery for the bulbous changes of the nose. So what causes rosacea? The cause is really not known, but again, it's a very stubborn condition that can last for many years. Certain foods and beverages may cause a flare, but it's not, the studies have shown that it's not really a certain food or beverage, but it's more like a thermic or temperature related thing. So warm food, spicy foods, things that are alcohol, things that get you heated up. And then other things that may flare, again, sun exposure, exercise, hot showers, so everything that gets your body warmer. Social situations, yeah, that flushing, definitely. And again, what's the treatment? There's not a cure. Avoiding triggers is the first step. Just try to pinpoint those triggers and try to avoid them. And then the antibiotics by mouth, they help, again, with the one that looks like acne. But the other ones, the blood vessel component, which is just the redness, is difficult to treat. Again, you can try Mirvaso if you dare to. But laser could be another option, but there's not a permanent treatment for this. What about adult acne? This is super common. This I get a lot of, at least twice a day, a patient that has adult acne. And the characteristic of the adult acne, when you see a teenager with acne, usually he has it all over the face. Adult acne patients usually have it on the lower half of the face. Usually in females on 30s, 40s, that's the most common type of scenario that we see in patients with adult acne. So women tend to get adult acne more often than men. Another thing to add to our list. If you're getting acne as an adult, it's likely due to one or more of the following reasons. So fluctuating hormones, again, those hormones there, stress, family history, skincare products, or some medicines. So we can experience acne with fluctuating hormones, and females go through different periods in their life that their hormones can fluctuate. So around the periods, if you're still a menstruating female, during pregnancy, peri-menopause, and menopause, our hormones are changing too, and after discontinuing or starting a birth control pill. Okay, stress. Also, stress is another trigger, not only for the seborrheic dermatitis rash that we saw, but for acne as well. Family history. Do you have any close relative, such as a first-degree relative like a mom, dad, brother, sister, who had that type of acne or really bad acne? Studies have shown that there's a strong family history as well involved in adult acne. And then hair and skin care products. Please make sure that everything, makeup, lotion, sunscreen, everything that you use on your face and body is non-comedogenic, or that it won't clog the pores. Because if you clog the pores, then you can have acne. I was just talking to one of my colleagues earlier today, and I think hair products should start stating that in their labels. Why? Because sometimes I see acne around the hairline, and then I wonder if there's a particular hair product that the patient is using that is aggravating or triggering their acne. So I don't know who I need to contact to make that a possibility. But I think that, maybe they would sell even more. Like maybe they don't clog the pores, but if they stated on the bottle of the product, it would be a good thing to know for the patients and for the physicians. And then acne could be a side effect of some medicines, so just sit down with your doctor and think if the acne started like a little bit after. Lithium is known to cause acne. Some medicines for seizures can cause acne, but of course seizures can be life-threatening. So I tell my patients, don't go stop your seizure medicine. Let's just sit down to your seizure doctor and see if there's an alternative that you can use, because acne is not life-threatening, but some conditions are, and you don't want to stop your medicine just because of that, okay? And then if you cannot take another medicine, you may want to see a dermatologist who can help you control the condition while you are on that medicine. And the treatment is similar to acne in teenagers, but it's more focused on hormonal control in females. And then this is in males. It's kind of like similar to acne. It has a very long, weird name. But just know that it occurs on the beard area and it's just ingrown hairs. That's what's going on. These are males. It's more common in black males because the hairs is more curvier. And what happens is as the hair is starting to grow, it comes back and reintroduces itself to the skin, and that creates an inflammatory reaction. So you have kind of like pimple-like lesions on the beard area. Females can get that on the legs too, but it's more common to see it on the beard area of males. And it can look like acne, but it's not really acne. It's just ingrown hairs, ingrown hairs. So the best treatment for this is just to do laser hair removal, because then you're done with the problem. Any questions with what we just discussed? No? Okay. Now stepping into the waters of brittle nails. Some of my colleagues call me brave because I talk about this. I made a lecture on brittle nails for one of our Texas dermatological meetings, and I made the statement, I'm doing this lecture not because I'm a renowned nail expert, but what triggered me to do this research is because there were a lot of patients coming to me with brittle nails, and there's not really much that can be done, but I wanted to know what was there and what was the evidence supporting the treatments that are there. So does this look familiar? Oh, to you? Kind of like those brittle nails. And what are brittle nails? I'm going to talk about that in a minute. But first, let's just talk about two important qualities of the nails. Nails are coherent, meaning they retain their shape and structure. Why? Because they're composed of hard keratins. The same keratins that form our hair form our nails, and that's why they're hard, right? But they're flexible too. They're very flexible. They have very low fat content and makes the nail plate or the nail 1,000 times more permeable to water. So for all of you who garden, all of you who like wash dishes a lot, all of you who wash our hands frequently, it's not uncommon to suffer from brittle nails because they're very, very permanent to water and permeable to water, and that can be a problem, okay? Or dehydration of the nail can be a problem too. So either end of the spectrum of water content, either too much water or too little water. And then contrary to common belief, calcium does not contribute to nail hardness. Does not. Calcium does not contribute to nail hardness. It is 0.2% of the nail plate's weight. Other minerals are more important: magnesium, iron, copper, sodium, and zinc. I mean, calcium, it is important, but it is not the most important factor for your nails. So brittle nails affects 20% of the population, and women, of course, again, here we are twice more affected than men. So this is by definition what brittle nails are. So they are defined by increased fragility of the nail, and this is manifested in two ways: either longitudinal ridging up and down your nail, or these breaks of the nail horizontally, okay? So it can occur either in the horizontal splits of the nail or longitudinal ridging of the nail. Either a combination of these or just one of these is enough to make the definition of brittle nails. Causes. So what causes brittle nails? A study showed that sulfur content was lower in up to 77% of patients with brittle nails, so sulfur content may be an issue. But many experts also believe dehydration to be a main factor for brittle nails. Other factors to consider: as we age, the nails will get more brittle. So that's just part of aging. Skin diseases and other systemic diseases can cause brittle nails, so that's why it's important to go to the doctor and see if you have any other signs and symptoms of other diseases. In brittle nails, it's very important external factors such as occupational factors, trauma, and nail cosmetics, okay? So that's gonna be very important too. So what's the proper care and prevention? Healthy diet. So people like to supplement minerals and do like calcium, vitamins, and magnesium. Just know that vitamin and minerals are called micronutrients. For a healthy body, we need macronutrients, which are the sugars, fatty, and I'm missing one, sugar, fatty, and proteins. So the meats and all of that we need, those are the macronutrients. But we have the vitamins and minerals and micronutrients, which means we need them in only such a small amount that very rarely dietary issues are going to be the cause of brittle nails. Very rarely, because in order to be deficient in vitamins and minerals, you're either not able to eat or have a condition that you're not absorbing well those vitamins and minerals. So again, it's very rarely to be due to diet. So if you like to garden, if you wash a lot of dishes, like I do, if you wash your hands a lot, well, if you wash your hands, you don't wear gloves to wash your hands. But if when you're doing gardening or doing any other wet work, try to use cotton-lined gloves to protect your nails, okay? When you go to do the manicures, keep the cuticle. The cuticles is the physical barrier between our nail and the nail matrix, which is what gives rise to the nail. So we want to keep the cuticle. Tell your manicurist, no, let's just keep the cuticle. Moisturize too, because again, moisturize is going to be able to retain that water content of the nail. And what about nail polish? There's controversies regarding nail polish. Some studies have shown, some people believe that at least the clear nail polish is going to protect the nail because it forms a physical barrier, but the problem lies in the removal method. So the nail polish removers, they can damage the nails by themselves. So that's the problem with the nail polish, that when you remove it, you can damage a little bit your nail. Vitamin role, like I was saying, vitamin and minerals deficiencies very rarely can cause brittle nails because these are micronutrients, so very small quantities are needed for normal function. So there's no evidence for vitamin supplementation in healthy individuals. If you're a healthy person, vitamin and mineral supplementation is not going to help your brittle nails. Now about biotin. Probably most of you or the majority of you have heard about biotin for hair and nails. So studies, yes, have shown that 2.5 to 3 milligrams of daily biotin for at least 2 to 3 months can benefit brittle nails, okay? But there's no benefit for normal hair. So it's not like, oh, I'm gonna get biotin to prevent brittle nails. So no benefit has been shown for normal hairs, but yes, for brittle nails, if you take it for 2 to 3 months. Once your nails have improved, it hasn't been shown a benefit again to continue the treatments after nails have improved. So only use it kind of like as a medicine. You treat it, they get better, and then just stop. And then restart supplementation if the brittle nails recur. Silicone, not to be confused with silicone, is another product that you can find in health stores. And there was like 1 or 2 studies showing that these can improve the thickening of the nail, and you take 10 milligrams daily for 20 weeks. It showed to improve nail brittleness as well. So you usually find it, this is one of the brands that I saw, so BioSil, but the main component is silicone, not silicone. These are 2 different things. And studies also have shown that it helps the hair too, so you want to take it for that too. But again, there's no improvement if you don't have any damage to start with. So it's, again, treatment of brittle nails or brittle hair. This is a topical product that you can use. It's called Nail, and it helps also prevent brittleness of nail. And these in studies have shown also to help a little bit. What I don't know for sure if this is over the counter or if this is a prescription. I think it's over the counter because I think there's only one that is prescribed. And then you apply this daily just above your cuticle of the nail to the affected nails, and it helps your brittle nails too. So this is another option that you can do. If you don't want to take pills, you can do the Nail. Genadur is another nail lacquer that only one study was showing that its main ingredient can also help brittle nail and brittle hair. So just know that there's other options available there for you, and just ask your dermatologist about them. This is the prescription one, okay? So you need a prescription for the Genadur. And then what about increasing water content? It could be important, particularly in the geriatric population. So I always tell my patients with brittle nail to soak their hands in warm water for 15 minutes before bedtime, and then just apply a thick emollient. Better if they have lactic acid or urea 5 to 20%. You can find this over the counter. Okay, so lactic acid, there's a moisturizer called Amlactin, which is over the counter that has lactic acid. And then Eucerin, other brands, they have urea too as their main ingredient. So again, soak your hands while you're watching the news or something at night, and then for 15 minutes in warm water, and then apply your emollient. And if you can wear like a sock or cotton-lined gloves before to bed, that would be even better. And then, does anybody know about shellac or the gel polish manicures? No? Yes?
I love it.
Okay.
It's really bad for me though, right?
I have a love and hate relationship with them. When I have it, I love it, but it's vicious because you want to keep doing it because it's so fabulous. But then when you remove it, the nails, at least mine are like paper thin, and that's why I hate it. So again, I may get one tomorrow. I'm still debating, but
Lasts forever though, like 3 months.
yeah. So this is a gel manicure. So it's like having a gel artificial nail, but the delivery is with a nail polish. So it's a gel nail, but instead of doing sculpting on the nail, like they just use a delivery method similar to a nail polish, so it's easier. And I think in my brain, I think I'm just getting nail polish, but it's not really just nail polish. Okay, so the gel polish manicure is a new, well, not really that new, but relatively new polish manicures that the color lasts to 2 weeks. But I don't do it because of that. I do it because it dries up immediately. Like you leave that salon and you can do anything and your nails are not gonna be ruined. I have 2 kids and I do a lot and I don't have time to just sit there and wait like an hour for my nail polish to dry. So that's why I never do polish because I'm avoiding these two. But the color lasts up to 2 weeks, and for all of us who wash our hands very frequently, our normal manicure can probably last like 2 days, maybe. So this again lasts 2 weeks. There's different brands. Shellac is just one of the brands. There's the brand called Gelish. There's an Axiom by OPI. So there's a couple of brands. So the generic name are gel polish manicures, and Shellac is just a brand. So the application involves 4 coats. There's a base, 2 of color, and then the top one. And in between each coat, they cure it with a UV lamp. And that's why you put your hands underneath a lamp to cure each coat and make it adhere to your nail, to your actual nail. So that's one of the problems. The shellac adheres to your nail, and then how do you remove the shellac? You have to soak it forever in acetone, and then when you're in a salon, since they don't have forever to take care of you, they sometimes use the buffer to kind of like buff it out of your nail. So there was a study done that demonstrated, actually they did like electron micrograph studies of the nail to analyze like every little like thickness of the nail, and they did find that after a gel manicure the nail indeed was thinner. Okay, so but they don't know if it's like the actual nail polish and the curing of it, or if it's the removal process. So we don't know why exactly, if it's the manicure or if the removal. So what about the nail lamps and skin cancer? Because some people may worry about, since you have to put your hands after each layer, after each coat underneath the lamp, so what does this pose for risk of skin cancer? So in 2009, there were one case report of 2 women who developed skin cancer on the dorsum of the hands. And the only risk factor they could look into both of these women was one of them had a 15-year history of twice monthly UV nail light exposure, and the other one had exposure to UV nail lamps for approximately 8 times in 1 year. So that was the only risk factor they could find in each one of them. So then a study did that they analyzed. So nail lamps emit principally UVA rays, and as we all know, UVA and UVB are like the most the sun rays that mainly come into the surface of the earth, and they can cause skin cancer. So they did a study and they did a mathematical model to see how important was this in the development of skin cancer. So for a gel manicure, for each time that you go get your gel manicure, the amount of time that you're actually exposed under the nail lamp is about 8 minutes, because it's about 2 minutes after each coat. So 8 minutes total for each manicure. So the mathematical model showed that tens or hundreds of thousands of women would need to use this type of lamp regularly for one to develop a skin cancer on her hands. So the conclusion, there is a risk, but it's extremely low. So me as your dermatologist, I'm gonna tell you there is a risk, but it's very low. And they conclude in this article, a risk likely to be accepted by most women. So, I mean, it is extremely low, but there is a very small risk. A lot of my colleagues, they buy the gloves. There's some gloves that you can buy that just have the nail exposed, and they bring them to their manicures. You can find them on Amazon, or I don't know, Sally sells them or Ulta, but you can get gloves that only expose your nail if you are a patient who already have had skin cancer, very fair complected, or have other risk factors, and you can use those gloves to do your manicure if you want to keep doing them. And that's it.
Oh, really, thank you so much
You're
for being
welcome.
here. I mean, and coming like time and again and really educating our community. Thank you so
Anytime.
much.
You're very
It's really
welcome.
wonderful.
UTMB Health, working together to work wonders.